This is a study, a prospective control study that we perform in Italy, in the hospital where I work, that is a children's hospital in Florence. And we analyzed the outcome, so what happened to children who are operating on for epilepsy surgery from the psychological point of view. And what we saw is that if the patients are cured by surgery, there is an improvement in their psychopathology. However, psychopathology is present in high percentage of children in the preoperative phase. So it's very important to evaluate this patient before surgery, to counsel the parents and caregivers about the possible consequences of the surgery, and also to assess carefully all the comorbidities that drug-resistant epilepsy can have. So we recruited almost 70 children who were on the waiting list for surgery at Meyer Hospital. Then we assessed them in the first evaluation. Some of them were operated on and some were not operated on. And then we compared the psychopathological status at the first recruitment and 1 year after surgery for operated patients, and 1 year after the first evaluation for non-operated patients. And then we compared the results between operated and non-operated. And what is new is this is a prospective study, so we did not assess patients who were evaluated in past, but we prospectively follow them. And the second advantage of this study, that is a control study, because we had a control group that is composed by the non-operated patients. And this is an added value. And also we performed different types of evaluations, not only questionnaires filled by the parents, but also when possible filled by the patients themselves. And also we use some other tools, for example, some psychopathological tests such as the BRIEF-P, or also to study executive function, the Conner's skills. And this was another added value, because we could assess the clinical diagnosis. So, for example, if the patients were affected by hyperactivity disorders, or thought disorders, or anxiety, mood disorders, and also we could compare the perspective, the parents' perspective, and the patient perspective, and the examiner's perspective. And we found that there are differences, because there are some aspects that are more valuable for the examiner and some others that are more valuable for the parents. So this is very important, because when we evaluate this patients, we have to take care also of the parents, of the caregivers.